Going up and joining us to talk more about who is contracting the virus and how we can move forward is Dr. Kelly Victory. Dr. Victory, welcome back to Good Morning San Diego. I hope your plane flight last night was a safe and joyous one.
Good morning, Paul. Great to be back with you. Thanks. Yes, easy flights, but a lot of mask wearing.
Yes, all right. So we were chatting, and this is the most recent numbers I could find for the state of California. You probably can't see them, but I'm going to throw them up. I bet you probably can recite the numbers by heart. The fact is that things start to get serious when you hit that 50 to 59 age group. As you can see that from 17 below, there were only 3 deaths here in California, ages 17 and under, and all 3 of those deaths had severe other related health issues. So when I show you this graph, what comes to mind? Who's getting COVID now?
Well, I think the important question to ask, Paul, is not who's quote unquote getting COVID, who's the positive cases are, but where the clinically significant cases are. And what I mean by that is we've done ourselves more than a bit of disservice from a public health perspective by testing these vast numbers of people who are asymptomatic. So we have a lot of quote unquote cases in the younger age groups because frankly, those are the people who are out and about, intermingling in public, traveling like I do, going to school, going to events. So we're seeing a large number of quote cases in the younger age groups because we're testing masses of people who have no symptoms whatsoever or have very mild symptoms, if any at all. The important thing is those people largely are not becoming significantly ill. There is no question that there is an exponential rise in the risk of becoming significantly ill or dying from COVID-19 as you get older. So if you look at the first 4 categories, those people under the age of 50, up to the age of 49, their risk is de minimis. They constitute somewhere around 70% of all the cases are happening in people under the age of 49, but they only represent a total of less than 7% of all the deaths. In contradistinction, if you look at those older age groups, people over the age of 65, they represent only about 10% of the cases, but 75% of the deaths are happening in people over the age of 65. That's remarkable, but a very important data point for people to understand as we move forward, because we know who the at-risk people are and therefore can do things to mitigate that risk, to rally around them and protect them.
I don't know if this is a fair question to ask, but is a COVID, how has the virus changed over the 5 months that we've gotten to know it? Getting sick with COVID now, is it the same as it was, say, back in March?
Well, it's a great question. We know that all viruses mutate, and coronaviruses are particularly savvy at it. They mutate relatively quickly. We know that COVID-19 has mutated multiple times since we first had the genetic sequence back in January. I think they're talking about somewhere in the range of 8 different identified mutations so far. The great news is that with rare exception, but as viruses mutate, they become less lethal. They become weaker. They become, less likely to produce significant illness. So that's the great news. So in all likelihood, as people get ill with this version of COVID-19, what's out and about right now, their illness is likely to be less severe than people who got it back in February, March, and April.
All right, so we're not breaking new ground here in the sense that we when we have to do this again, and I assume at some point we will, the first thing we want to do is protect the seniors, correct?
Absolutely. And this virus is very different from other viruses. If you look back, say, to the Spanish flu in 1918, the target group for that virus, the people who became profoundly ill and died, were actually people in their prime working years. It was people between the ages of 19 and 49 who were most likely to become ill and die. And that was quite devastating. Not that any death is not tragic, but it's far easier when you can know and can identify that the actual target group from this one are those elderly folks, because number one, they largely are no longer in the workforce. People over the age of 65 are less likely to be working, and certainly people in their 70s and 80s. So it makes it very easy for us as a society, as a culture, to do things, to put in place mitigation procedures and to protect those people very carefully. They are the vulnerable. They are the at risk from COVID-19. We know who they are. We know that children in particular have almost zero risk from becoming significantly ill. And we know that young people in general and asymptomatic people in general are unlikely to spread it. And even Dr. Fauci has come out publicly and said that asymptomatic people really are not the ones who drive a pandemic. Can they spread it? Yes. Are they likely to? No. So knowing who the at-risk population is incredibly important in terms of our managing this and allowing us to get back to life as we knew it previously.
In your view, does that make having kids back in class an easier decision to make?
Well, I've said from the beginning, yes, I think there is absolutely no reason not to have children back in school in person. And I think many of the things that they are doing, unfortunately, in terms of mitigation, meaning the plexiglass shields and children wearing masks and social distancing, is really unnecessary based on what we know, what the science is showing us, and what we have seen from leagues of countries around the planet that went back to school before we did. So yes, I am 100% in support of children going back to school, and frankly, without all of these mitigation procedures.
Dr. Victory, thank you for getting up early for us after traveling like you did. We appreciate it.
Thanks for having me, Paul.
All right, we'll talk again. Dr. Kelly Victory, everybody.